Thank you for joining us today. I'm going to show you how to use the SABINA Sit to Stand to mobilize your patients earlier and often. It's important to note that every lifting situation is different because every patient is different, whether size, morphology, weight, or condition. It's always important to keep that and always reference your patient handling policy when transferring patients. First, I'm going to review the basic functions of the SABINA lift. The SABINA has a weight capacity of 440 pounds, which can be noted on the product label located on the mast. It's also important to know that you always have to plug in the lift when it's not in use. This is a standard plug that you plug into a wall to charge the battery. And then if you want to notice where your battery life is or how that works, you would go ahead and take a look here on the battery display, which will tell you the level with which your battery is charged and if it needs to be charged again. Next, we're going to talk about the emergency reset button. The emergency reset button will disengage the functions of the lift from working and also stop the battery from working. To activate the emergency stop, we're going to go ahead and press the button in. This will disengage the lift again. We need to turn this red knob a quarter of a turn to the clockwise direction and it'll pop out, which will reset that button for you. Next, we're going to talk about the hand control. The hand control on the SABINA has four buttons for up and down. We're going to have the wider up and down buttons, which will allow you to do a standard speed on raising and lowering the patient. The narrower buttons will just be a little bit of slower speed to raise and lower those patients. And then the other option on your hand control is the base. We can widen and narrow the base based on this, which gets us around obstacles. Next, we're going to talk about emergency lowering. The emergency lowering is utilized if you're using the lift and the patient is raised in an up position and you need to lower them back down, but you have run out of battery. We can do this by go ahead and simply pulling up on this lever. And if there is a patient in here, it will hydraulically and safely lower them back down to a safe position. Finally, we're going to talk about the brakes. When you want to activate the brake, you step on the lever, and then when you want to deactivate it, you go ahead and push the lever on the top back and it will deactivate the brake. Next, I'm going to demonstrate how to transfer a patient from bed to chair using the SABINA and a safety vest. This is our safety vest. Our safety vest has, as well as all of our slings, has a tag on the back side. The tag tells you the weight capacity, the type of sling, the model number, and it should always be facing away from the patient. There's also a blue tag located on the sling that tells you this is a large sling and what patient capacity it should have. Next, we're going to talk about the braided strap. This is the braided strap that wraps around the front of the patient to offer a little bit more security around that patient. And then we talk about our other strap that offers a little bit more comfort when we're in support when we're attaching it. So to put on the safety vest, we're going to go ahead and wrap it around the patient like this. So to put on the sling, I'm just going to go over to the patient and I'm going to put it behind the patient, kind of seating it in their lower back, kind of right here. And then I'm going to go ahead and wrap it around. And I'm going to take the safety belt, which is these braided straps, and I'm going to take this braided strap and put it through the opposite side D-ring. And then I'm going to take this braided strap here and also put it through the other side of the D-ring. And then I'm going to measure it up for the patient using the outer piece on both sides, so it's snug, but it's not too snug for the patient and gets uncomfortable. I'm going to go ahead and grab the SABINA lift, bring it into our patient, making sure that the patient's feet come in contact with the foot plate, and also we have the leg rest, making sure that this leg rest is below the knee. Now I'm going to go ahead and attach these braided straps as well as these outer straps. I'm going to put the braided strap like we measured here and here. I'm going to put this braided strap here and here. Once everything's secure, we're going to go ahead and come back here to our hand control. I'm going to go ahead and raise that patient up, asking them to please sit back. We're going to go ahead and take our hands and put them here so they don't hold up, and let the lift do the lifting. Once we go ahead and just clear the surface, which is where we are, we can go ahead and take the patient from the bed and transfer them to the chair, lowering them back down when we get to that surface. Once that patient's in the right position, we can go ahead and take off our sling bar. We're going ahead and taking off that sling bar, taking the SABINA and pushing it away so it's not in the patient's way. And when we want to take off the sling, we're just going to go undo this braided strap And this braided strap, have the patient sit forward and take that off. There's also another option that we have available that you may have a purchase for your facility, which could be the Solo. This is a single patient use vest. Again, you'll notice it has just the outside. It doesn't have that inside belt, so you would just attach these two to the sling bar on the SABINA and lift your patient that way. For more information, you can contact your local Hillrom representative or reach out to hillrom.com.